kidney diseases, people with endocrine abnormalities, diabetes, and thyroid abnormalities come to mind. Actually, their inability to carry pregnancies, people with chronic liver disease, in the management of those conditions, you now find that they actually have a metabolic endocrine disease that is actually not allowing them to carry pregnancies to term. Of course, as you quickly run to lifestyle, it is almost, the incidence of spontaneous abortion is higher by more than 50% in women who smoke and attempt to get pregnant. The simple analysis of that is that nicotine in the cigarette will get into the maternal blood, get to the fetal blood, and constriction of the fetal blood, and of course abortion. The other one is alcohol. It is not advisable to attempt to carry pregnancy and be taking alcohol at the same time. Of course, there are a lot of syndromes that admix. If you look at our everyday situation, people, by the time they finish their education, by the time they're on the job market, by the time they eventually get married and start looking for pregnancy, they are very close to 30, if they are not more than 30. That pushes them towards the tendency to have abnormal conception, which eventually will lead to that. Then some of them in early pregnancy, they are working. Some of them has a coexisting uterine fibroid and all these other factors. Some of them will take alcohol. And of course, all these are conditions that will eventually encourage spontaneous termination of pregnancy. And as you quickly say that these miscarriages, we are talking about pregnancies that terminate before that fetus has reached age of viability. Now, there are country differences. Age of
viability will be what age?
There are country differences. What I mean by age of viability is if a pregnancy terminates, in the US, for example, age of viability of pregnancy is set at 20 weeks. What that means is that if you have an abortion, a spontaneous abortion, and the fetus is alive, they have enough technology to nurse that baby at 20 weeks until it is matured. In Britain, it's about 23 weeks. It depends on, but in Nigeria, it's about 28 weeks because the only thing we have is the incubators.
Okay, and I hear that sometimes some women, the cervix opens too wide or in early pregnancy.
The cervix is the lower part of the uterus, and as pregnancy increases, it is going to be the one to bear the brunt of the weight of the pregnancy. If that pregnancy is not competent, the cervix begins to open and pregnancy is lost. It is also thought that, if I should mention it, that previous history of involvement in criminal abortion procedures causing forceful dilatation of the cervix in several occasions can actually make somebody end up with an incompetent cervix. Again, it's a condition that has treatment.
Okay, we'll still talk about the treatment, but let's talk about the signs that a woman may be losing her pregnancy. What are those signs?
The cardinal sign of termination of pregnancy spontaneously is the noticing that blood is beginning to come per vagina after some period of missed period and probably having done some tests to confirm pregnancy, after which you begin to notice bleeding, is the first sign that herald the beginning of process of termination of pregnancy.
You're talking about heavy or light bleeding?
It usually starts, it has a rate of starting heavy, but at times it starts light and rapidly becomes heavy.
Conception and during pregnancy can help you and your baby stay healthy. We'll pause here now and return with the news making the rounds.
Every day you invite us to your home. Now we invite you to our homepage. Join Channels TV on social media. Hang out with us on Google Plus/Channels Television. Follow us on Twitter.com/Channels TV_NG. Find us on Facebook.com/Channels Forum. And don't forget to like our page. That's not all. Subscribe to our YouTube channels. YouTube.com/Channels Web to get constant video updates on news and events in Nigeria and around the world. ChannelsTV.com, the news at your fingertips.
On the news segment, as the Ebola outbreak evolves in Guinea and Liberia, there's a continuous need to be aware and protect yourself.
Remember that Ebola virus disease is a severe, often fatal illness. The infection is transmitted by direct contact with the blood and body fluids and tissues of infected animals or people. The drivers of the infection are fruit bats, which are considered to be the natural host of the Ebola virus. The illness is often characterized by the sudden onset of fever, intense weakness, muscle pain, headache and sore throat. This is followed by vomiting, diarrhea, rash, impaired kidney and liver function, and in some cases, both internal and external bleeding. Severely ill patients require intensive support care. Ebola virus disease outbreaks can devastate families and communities, but the infection can be controlled through the use of recommended protective measures in clinics and hospitals, at community gatherings or at home. Regular hand washing with soap and water, especially after handling animals, is also recommended. Just to add that there is no vaccine or cure for Ebola virus disease. So do all you can to protect yourself. If you or anyone around you have a fever that seems to defy medical treatment, report to the nearest health facility.
And as the 2014 World Malaria Day highlights the need for continued investment towards the elimination of malaria infection, the World Health Organization is calling for more political commitment and sustained support from countries in their efforts to control and eliminate this deadly disease.
Although since the year 2000, there has been a 42% reduction in the global malaria mortality rate, and many countries have declared malaria elimination as a national goal, malaria still caused an estimated 627,000 deaths in 2012, mostly among African children. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected mosquitoes. Malaria prevention and control measures include vector control, which is the main way to reduce malaria transmission at the community level. For individuals, personal protection against mosquito bites represents the first line of defense for malaria prevention, and this can be achieved through the use of long-lasting insecticidal nets. The theme for the 2013 to 2015 campaign is Invest in the Future, Defeat Malaria.
So vaccination matters. Immunize for a healthy future. Know, check, protect. This is the message for this year's World Immunization Week that calls attention to the importance of immunization.
Citing the example of measles, the World Health Organization says there has been a 78% drop in measles deaths worldwide between 2000 and 2012. The health agency is imploring parents and caregivers to check whether the vaccinations of their children or wards are up to date and to make sure that these children get the vaccines they need.
Finally, the Saudi health minister has been sacked without explanation as the Middle East respiratory syndrome coronavirus death toll in the country climbed to 81.
Abdullah Al-Rabai was dismissed just days after visiting hospitals in Jeddah to calm a public hit by panic over the spread of the respiratory virus. Saudi has registered the largest number of infections of the coronavirus. The ministry said it had registered 261 cases of infection across the kingdom. The World Health Organization says it has been informed of 243 laboratory-confirmed cases worldwide, including 93 deaths since the virus was first discovered in September 2012. The WHO, which has been monitoring the global situation, says there is currently no reason to impose any travel restrictions because of the virus. Public Health England said the recent rise in the number of the Middle East respiratory syndrome infections in Saudi Arabia could be the result of a number of factors: a change in the virus itself, a consequence of more active surveillance, or some sort of seasonality.
That's the show for this week. Thank you so much for watching. I'm Yomi Altaigbe.